So I want to quickly look at another disorder of calcium metabolism. This is what is known as what? Hypercalcemia. So hypercalcemia as a disorder of calcium metabolism. Right. So for this hypercalcemia, it just simply has to do with what? Calcium levels in blood serum are kind of like shooting up. Calcium levels in blood serum are shooting up again. So hypercalcemia is an elevated level of calcium in the blood. Alright. So it is a significant disorder of calcium metabolism. It arises due to the disruption of calcium homeostasis. So calcium is not being regulated. Normally the calcium levels in the body are tightly regulated by the parathyroid hormone, vitamin D, and other mechanisms. But once this regulation is disrupted, you have this what? Hypercalcemia coming in. So what's the pathophysiology? It could be due to what? Increased bone resorption. That's possible causes. So increased bone resorption, you can have it in primary hyperparathyroidism or humoral hypercalcemia of malignancy. It could be due to that there's so much absorption from the intestines of calcium. Granulomatous disease like tuberculosis or sarcoidosis can elevate calcium absorption, right? So calcium absorption is mostly you always go hand in hand with increased vitamin D levels. Then decreased renal calcium excretion. It could be that calcium is not being excreted as it should. You understand? Then causes is sometimes primary hyperthyroidism, okay, cancers, vitamin D toxicity. So if vitamin D is excess, you have these problems. Other problems is if you're using medications, so thiazide diuretics, endocrine disorders like you have hyperthyroidism or adrenal insufficiency, okay, genetic conditions like familial hypocalciuric hypercalcemia. All of these are actually stuff that can actually cause hypercalcemia. Okay. Symptoms is mild hypercalcemia is usually asymptomatic, or you might just be having one or two mild symptoms like just weakness, nausea, constipation. Then if it is moderate to severe, you can now be having the involvement of the nervous system, gastrointestinal involvement, renal involvement, okay, coming. Then sometimes you can also be having the cardiovascular involvement, right? That's all those hypertension, arrhythmias, and the rest. So management is hydration, all right, intravenous fluids and all of that. They can use pharmacological interventions like biphosphonate, calcitonin, just to reduce, okay, calcium levels. Then denosumab, right? Okay, glucocorticoids. Then dialysis, because you want to what? Filter out calcium levels in the blood, right? So most of the times you also need to treat the underlying cause. So it's usually due to something, so treat the underlying cause and you have it solved. Okay, so that was it for an overview of hypercalcemia.